Hello, and welcome to today's webinar. This is our third and final webinar for the series on simulation's role in next generation NCLEX success. A small group of experts will discuss virtual simulation and the importance of debriefing. We know your time is valuable and we appreciate you spending it with us. First, I would like to go over some logistics. Our experts will be answering some questions at the end of the presentation, so please type any questions you have in the Q&A box, and we will answer as many as possible. This webinar is also being recorded and will be shared with all attendees after today's events, and the first two webinar series, as well as this one, will be available on the OADN VSR website. Lastly, there is a survey at the end of the webinar, and your feedback is very important to us. So please take a few minutes to fill that out when you have some time. Now, let me quickly introduce our panelists. Nina Leverkuhn is a faculty member at Blinn College. Nina graduated from Western Governors University in 2021 with a Master of Science in Nursing Education. She now teaches adult health theory and clinical, as well as a skills course. Dr. Janeen Berndt is the National Director of Clinical Innovation and Integration at Blinn College of Nursing. Dr. Berndt has been a certified nurse educator since 2006, holds a DNP from Valparaiso University, and is active in the Psi Upsilon chapter of Sigma. At this time, I will turn over to Nina. Nina, thank you. I understand how frustrating technical difficulties can be. I will do my best to give a little more context here. Nina and Janeen are going to be discussing the debriefing process, which is part of the healthcare simulation standards of best practice. And they will talk about a little bit from what was covered in the first two webinars for pre-briefing in the classroom, and then why debriefing is so important to pull that all together. And again, we will be answering questions after we show a short video. So please feel free to type them as you go along, and we will go from there.
Hi, my name is Nina Leverkuhn. I'm a nursing instructor at Blinn College in Bryan, Texas. And the SIM task force, one of the things we're discussing today is debriefing and how we can encourage students to be more successful on the NCLEX with the new next gen type questions. So first of all, I'm going to talk about INACSL. That's the International Nursing Association for Clinical Simulation and Learning. This is a professional organization that is key in research on simulation education, and they have developed standards for simulation, and one of their standards is on debriefing, and that's what I'm going to talk about today. So INACSL believes that all simulation-based education must have a planned debriefing process, and this will be a process that is based on a theoretical framework or evidence-based concepts. And the process will identify and resolve gaps in the students' knowledge and assist the students to develop insights, improve their future performance, and promote transfer of learning to their actual clinical practice. And true learning requires the integration of experience and reflection, and that's what the debriefing process does. Now, INACSL states that the debriefing process has three parts. The first is feedback. This is the feedback we give to the students. It needs to be unidirectional. We're the professional, they're the novice, but it also needs to be constructive. Then we need to include debriefing. This is a formal collective process. It encourages reflection. We're reminding the students of the purpose of the simulation. We're diffusing reactions to the simulation. We're discovering any knowledge gaps that exist, and we're applying insights that are experienced by the students. And the last part is guided reflection. This and debriefing really facilitates this, and this is where the learners explore critical elements in the simulation and guided reflection frequently is integrated into the debriefing process, but the ultimate goal for debriefing is to promote reflective thinking, because this is where the learning happens. Reflection is a conscious reconsideration of the meaning of action. So we're assimilating knowledge, skills, attitudes with the student's pre-existing knowledge, and this is going to produce a safe learning environment where the students can take their knowledge to the next level. So in order to meet the NASCL standard, debriefing is planned. It's facilitated by a capable, competent debriefing faculty. It encourages reflection, identifies deficits, and it does it in a safe manner. And it always utilizes evidence-based concepts. So NASCL has 4 criteria for debriefing, and the first one that is that it's planned and it's incorporated into simulation-based education to guide the learners to achieve the objectives. You know, anytime we do anything, we need to have a goal, we need to have objectives. Well, one of the parts of debriefing is these are our goals and this is the direction we're going. So in pre-briefing, which Ms. Sammy Robbins' group has already discussed, very important for debriefing to be successful. Debriefing always occurs after the simulation-based education. Debriefing is very learner-centered. It's individualized to the simulation scenario. It's individualized to the student group, and it's individualized to the nursing program. So then it's also adaptable. You know, nurses are flexible. We have to be flexible. Well, you know, nurse education is the same way. And then debriefing also has multi-phases. So this promotes a deeper exploration of the learner's performance and thinking process. The second criteria is that debriefing is facilitated by capable, competent debriefers that are able to provide appropriate feedback and reflection with the student learners. So the debriefer needs to be trained and skilled in the debriefing process. It's important for the debriefer to be familiar with the case. If you don't know what happened in the simulation, how are you going to be adequately able to lead the students through the debriefing process? It's important to strive to demonstrate continued competency in the debriefing process. So this means that you don't just learn it one time and then you're done. This is a continued learning process, and that debriefers need to be evaluated from time to time to make sure they're still providing the best debriefing possible for their students. You need to allow adequate time for the learners to achieve the objectives of the simulation. If we rush through any of it, whether it's the actual simulation or the debriefing process, we're really selling our students short. It's suggested to use the Socratic approach when you're discussing. However, as long as an instructor is able to ask the essential questions, you may not need to use the Socratic approach if that approach isn't really something you're comfortable with. But there needs to be an unbiased critique of the performance of the students, and that all analysis of the performance needs to be constructive and unbiased. Communication skills are very important for the debriefers. That you need to utilize active listening, be comfortable with silences while the students are processing the experience, and respond in a non-judgmental demeanor, and because sometimes that can be a challenge. But the process if you have a capable, competent debriefer, then the faculty member is able to identify any performance or knowledge gaps in the students. So criteria 3 is where we want to promote self, team, and system analysis. So this is something I like to model for my students. I tell them when I work, I debrief myself on my way home. So I think sometimes it's important for the debriefers to debrief. So how do you think you did? And did you do an adequate job to guide your students to increasing their performance level and being able to think critically? So it's important to allow for some privacy, open discussion, and trust. There needs to be confidentiality. What happens in simulation stays in simulation. So students need to feel safe to be able to express their self-doubts, and sometimes they feel like a failure and they need to be able to express that as well. It's important to incorporate multiple points of view. Your view isn't always the most important or the only one, and you need to focus on behaviors and the relationship of these behaviors to the objectives. Always point back to the objectives. And a good debriefing allows for clarification so that we increase the student's performance, especially when you have a student that isn't aware that they have some performance deficits. Finally, criteria 4 is that the debriefing process should be based on a theoretical concept or an evidence-based concept. So which debriefing process or concept you use will depend on a lot of different factors. First, the complexity of case. Some cases are much more complex, others are simple, they have much more simple objectives. So sometimes that will guide what type of debriefing you're going to do or utilize. Also, then you have to consider the level of your nursing students. The debriefing process that you use for an undergrad nursing student versus a postdoc nursing student is totally different. So you have to consider the knowledge level of the student that you're working with. Also, you have to consider the time available. So we have sometimes, simulation educators, we can be very creative and we have lots of amazing ideas. Well, you know what? You can't do them all at once. And so sometimes you have to scale back what you think would be great to do, because again, you got to look back to your objectives. What's my objectives here? All these things I'm thinking of is great, but I have a limited amount of time, so I need to go with what's going to help me achieve my objectives for my students. And a debriefing needs to be a structured process, but we need to have some flexibility in the process. So it sounds like an oxymoron, but it's really not. Because sometimes an issue will come up, or the students will have a question and you need to have a timeout and let's work through this issue or question, or maybe a student needs to do a quick research and find an answer for a question, and then we can get back to the business of debriefing. But the great thing about debriefing is it promotes critical thinking and reflection, and this is where the learning takes place in simulation education. And this is where simulation is going to make a difference with the new NCLEX, the Next Gen, because that is what is being incorporated in Next Gen questions, is critical thinking. And this is where simulation, whether face-to-face, real-time, or virtual, can really make a difference in how we prepare our graduates to be successful on the NCLEX exam. So another thing about debriefing is it encourages the learners to look for evidence-based solutions to patient problems, and it fosters the students' ability to apply new knowledge, new skills, new attitudes that they can take to the next clinical setting that they have when they're caring for actual patients, and then they'll be able to problem solve an actual human being's issue, and that is empowering for the students. And there are a variety of resources that we will have listed of different debriefing processes. Remember, they need to be evidence-based. I personally use Debriefing for Meaningful Learning that was created by Dr. Chris Dreyfus Dreyfus. And when I heard Dr. Dreyfus speak at a weekend seminar, it was like a Lion King moment for me. Dr. Dreyfus was Rafiki holding Simba, the debriefing for meaningful learning, up to me, and I was one of the rhinos down at the base of the cliff bowing, because it just ticked all the boxes of things that I wanted to accomplish in debriefing. And hopefully you'll find a program that does that for you. There's lots of options. There's Debriefing for Good Judgment, which I think is a great program. There's Pearls, Promoting Excellence and Reflective Learning in Simulation. There's the 3D module, which is Diffuse, Discover, and Deepen. There's the DASH, Debriefing Assessment for Simulation in Healthcare. There's lots of different processes of debriefing that include reflection and that are evidence-based. So do some research and find the debriefing process that works for you. So Janeen and I would be happy to answer some questions, give you our experiences with debriefing and some ideas about how you can apply next gen thinking in your simulation process and in your debriefing process. Thanks for your time, and I hope that you found some morsel that you can use in your teaching experience.
Well, good afternoon. How are you guys? Nobody wants to talk to me? Okay, well, I think we're supposed to do something. You all were supposed to do like a virtual clinical. Ooh, Ken, that looks good. What are you eating?
Sun chips.
Are that what flavor?
Garden salsa.
Oh, have you had these before?
Yes, I love those.
So hang on for just a second. They're saying they brought pizza into my house. I'll be right back.
And
okay, so anyway, y'all were supposed to do something on the computer that dealt with the replacement of the regular clinicals, and you had some instructions on what to do.
I didn't see any instructions.
Yes, ma'am. They were posted that you were supposed to what DSIM you were supposed to complete, and that it was also on the same announcement that had the Zoom link for us to talk this afternoon.
Well, I didn't even. Well, I'm up at my sister's office right now, and I don't have internet at home. I mean, it's like we live out in the middle of nowhere, and it comes and goes. What am I supposed to do?
Well, I guess that's something that you'll have to take up with the director, because I have no idea what kind of, specifics that the computer has to have or anything like that. Or
am I the only one that couldn't get in? I couldn't get in. Am I really the only one that couldn't get in? I'm having a real hard time believing that.
I did mine at Starbucks, so I don't know. You might try that.
Like I said, I'll have to get with my director, because they're the ones that'll have to get in touch with the company to see if you have access or not. So
let me call you back.
Can you tell us what's going to be on our next test, Ms. Grimes? I'm really worried about that.
No, I have no idea.
Can't you give us like a hint? Like
The only hint I can give you is to study. And if you paid attention in class, I think you'll be fine. Hang on, I got to get a bite of pizza. I'm sorry. I can't hear you, Miss Cockrell. You've got your mic muted.
I'll try to.
What about you, Ken? Are you pretty smart with computers? Okay. Well, so you said it was pretty intense, that VSIM?
Yeah.
Miss Cockrell, you're unmuted now.
Yeah. Are we done yet?
Not quite, I don't think. Was that Mr. Shapiro?
Yeah, that's him.
Okay. I haven't watched the case. I really couldn't tell you. So this virtual stuff, you know, I'm an old lady and I'm just not really familiar with the computer stuff. So that's why I can't help Miss Cockrell. Do y'all know if the other groups have already did their little meeting? I think that a specific word they call it, but have they had their meeting? Do you know if the other students have? Y'all don't talk to any of the other students?
Huh.
Oh, sorry. Sorry.
Well, y'all don't have any questions?
I'm good.
Well, nobody else is talking, so I guess we're all done.
Well, that certainly is a good example of why we need best practices for the debriefing process. So the healthcare simulation standards of best practice include key features of best practice in the debriefing process. Some of the key criteria include that the debriefing process should be planned and incorporated into simulation-based activities. It should be constructed, planned, and or facilitated by those competent in giving feedback, debriefing, and or guided reflection. The debriefing process should promote self, team, and or systems analysis, and it should be purposefully planned on and based on theoretical frameworks or evidence-based concepts. Now, let's consider the virtual setting. The practice standard tells us that the debriefing process needs to be adaptable to all simulation-based modalities. Virtual simulations should follow the healthcare simulation standards of best practice, just like any other simulation modality. The debriefing process doesn't have to be face-to-face in order for this standard of best practice to apply, as long as the process is reflective and includes the 3 key phases of the description phase, which is a reminder of the objectives, the reaction and diffuse phase, where students react and reflect on their experience, and the analysis and discovery phase, where the facilitator assists the learners to understand and identify their own knowledge gaps. Another place where this best practice can improve debriefing is in the clinical setting. During post-conference, debriefing can follow the same debriefing methods we use in simulation and should include the same structured, purposeful phases: description, reaction, and analysis. Now let's go back and take a look at our virtual debriefing session, and this time we're going to see them using the healthcare standards of best practice to guide their process.
So welcome to our debriefing session for Mr. Carl Shapiro, who y'all completed the virtual simulation on this morning. Can you tell me like how you're feeling after completing your virtual simulation?
Well, how am I feeling? I guess relieved to get that experience behind me.
You think that when you encounter that again in real life, that will, resonate with you? Anyone else like to share their experience today? Let's talk about what happened in our simulation. Okay, so here's our patient. We're introducing our patient here, Mr. Shapiro. So tell me what things that you learned from when you first enter the room and what you're supposed to do.
Well, I mean, just reflecting back on, what we've discussed in lecture, just the importance of introducing yourself to the patient, and then just that visual assessment of what's going on with the patient, in addition to what they're saying, just kind of taking those visual cues of what's going on.
Okay, very good. Thanks for sharing. So when y'all entered the room and you introduced yourself and you washed your hands, what are some potential things that you thought could be wrong with Mr. Shapiro?
when we are entering the room and Mr. Shapiro has his diagnosis of myocardial infarction, what priority nursing assessments do you think we should do?
So I saw the nasal cannula and I thought respiratory.
Kim, would you like to add anything? Or Linda, would you like to add anything?
The patient's chest is not moving.
Did any of you witness this same thing happening when you were doing the scenario? The patient's chest not moving?
Yeah, and I freaked out.
Well, tell me if you were back in the room right now as a nurse, now that you've had some exposure, what would you do after you walked in the patient's room and the patient was not breathing? Where would you start? Okay, so those are some very good points that we've made today. Now let's take a look at our objectives right quick. What have we learned from this? And we're going to take from the simulation and we're going to apply it in our life as a nurse. So when we're out there on the floor working, what things are we going to take from this situation? Just as a reminder, I know it was in your announcement, but I will be sending out a survey so that we can reflect on this assignment to see, what things about it that you liked and what went well, and just follow up survey on that. So please do that for us. And then you will be having a post assignment. And part of your post assignment is going to be to complete an SBAR for your patient that you cared for today. So make sure that you complete that assignment and get that uploaded to your learning management system, okay? And lastly, Linda, if you don't mind, I'd like to schedule a meeting with you following this debriefing, just so that we can discuss, what happened in debriefing today. So thank you all for your attention and time, and I'll talk to you later.
Thank you, Ms. Chanley.
Hopefully you can see the difference between a debriefing session that's what we call on the fly versus one that's well prepared and well planned ahead of time using evidence-based methods and intentional planning. I hope that you were able to see that the students were more engaged and that the learning process was much more enriching for them. So now let's talk about integrating Next Gen NCLEX practice into the debriefing process. So think about the prompts that we use during debriefing or post-conference to get students to think to the next step, how we guide them to consider what does that mean as part of their learning process. Here on this slide, you can see how the debriefing phases align with the nursing process, Tanner's clinical judgment model, and the NCSBN clinical judgment measurement model. This alignment is helpful when we're planning our debriefing sessions so that we can follow not only the nursing process, but also consider the NCLEX clinical judgment model. So here on this slide are some examples of prompts that we might use during each one of the phases of the debriefing process. So you can see that the reaction and description phase of the debriefing process aligns with the nursing process phase of assessment, Tanner's noticing phase, the NCSBN clinical judgment model phase of recognizing cues. So an example prompt for that might be, what did you notice in your patient today? In the next phase of the debriefing process, which is understanding and analysis, this aligns actually with multiple phases of the nursing process, including diagnosis, analysis, planning, and implementation. It also aligns with Tanner's clinical judgment models, phases of interpreting and responding, and the NCSBN clinical judgment measurement model phases of analyzing cues, prioritizing hypotheses, and generating solutions. So some example prompts of what we might ask students during the understanding and analysis phase of debriefing are, which cues alerted you to this patient's need? And for planning or generating solutions, we might ask, what are possible actions you could have taken in response to those cues? These are also good questions that you might take or that you might ask students during a clinical day. Another one for taking action is, which action did you take and why did you select that action? And then finally, the final phase of the debriefing process is application and summary, which aligns with the nursing process phase of evaluation, Tanner's phase of reflecting in the NCSBN model for evaluating outcomes. And this is where we can just ask students to reflect on what they did and whether or not that was effective. Was your action appropriate? And how do you know that it was appropriate? What signs did you see that indicated that your nursing care was appropriate? So now let's take a look at how we can incorporate NCSBN clinical judgment measurement model practice into debriefing using a specific model. In this particular example, I'm going to use the PEARLS debriefing model. So the first step when you're using the PEARLS debriefing model is to set the scene or to establish psychological safety. It's very important that we establish a safe container for learning so that students are comfortable stepping outside of their comfort zone to explore new thoughts and have new experiences and different ways of looking without feeling the threat of being judged for their viewpoints or their experiences. The next step, and you saw this in the example of our debriefing using the standard of best practice, is to ask the student, how do you feel about this experience? How do you feel about the care you provided to this patient? Followed by the description, how would you describe your experience today? Or how would you describe this scenario or this patient? And then that's followed up with the analysis phase of the debriefing process. In this particular example, we're going to discuss learner self-reflection, which is one approach to the analysis phase of debriefing in the PEARLS model. So some ways that we might incorporate NCSBN clinical judgment practice is to ask prompts such as, what did you notice in the patient that alerted you to this condition? Or what action did you take? What actions could you have taken? What was the outcome of your actions? And what would the outcome have been if you'd taken a different action? In the application and summary phase of the PEARLS model, we might ask students to list possible actions that could have been taken, which one was the best option, how do we know that that action was effective, what would have been different in a different clinical setting, or if we were in the clinical setting as opposed to the simulation setting. And then, of course, what are some takeaways from this experience? So as you reflect on being a future nurse, how will you apply this experience to your practice? And here are some references that we use to prepare this presentation for you all, if you want to look at any of them in particular. And also, don't forget that at the OADN 2022 convention coming up November 18th through the 20th in New Orleans, we are holding the OADN Simulation Committee is holding a half-a-day workshop on the 18th. Our workshop is number 203, where we're going to go into more details on simulation's role in next generation NCLEX success. We hope to see you there. Thanks so much for coming to this webinar.
Thank you, Nina. Thank you, Janeen. We did have a few questions that came in, so I will defer to both of you to answer. Nina, if you are still having troubles, feel free to type in the comments and I can read them out loud as well. The first question that came in is, what debriefing models theories can we use for integrated next-gen style practice?
Well, I think that as long as your debriefing process has a robust reflection portion, then that is going to help guide the students to be able to handle the next gen type questions, because that's what they're trying to do with the next gen, is to incorporate more measuring critical thinking. How well do our new nurses critically think? And that's something that will be strengthened by reflection. In particular, one of the reasons why I like debriefing and meaningful learning is there's specifically what Chris Dreyfus calls reflection in action, reflection on action, and reflection beyond action. So this is where we guide the students to reflect. In action is reflecting about what was happening at the time during the simulation. What were they thinking about? How did they make decisions? And the experience itself. And then reflection on action is thinking about the simulation after the event, thinking about something that happened during the simulation, what the student might have chosen to do differently if they were presented that situation again, or was there new information that they gained or a new perspective. And then finally, reflection beyond action is where the application comes. This is where we talk about taking what we learned in the simulation into the clinical setting or a different, perhaps, type of patient. Because we all know that some simulations, what happens with one patient can happen to a different patient in a different, for example, something happens in a med-surg patient, but then it also can apply to when we're taking care of a new mother on a postpartum unit. So we can apply what we've learned across the lifespan. So thinking about how I'm going to use this when I'm taking care of a patient on my own. So I think as long as we have the reflections. Now, one thing that's unique about the virtual simulations is we can do things like quizzing. If we develop a quiz, we can use some of the new next gen type questions, which I think really lend themselves to simulation, like the case studies. I mean, basically these virtual sims are case studies. I mean, it's just perfect. So a lot of those, the bow tie items, those are great. I just love them. And, you can really get the students thinking about what their priorities nursing actions are using these type of question items. So a quiz, having a quiz after the sim, after they've completed the virtual sim, is another way where you can incorporate the next gen type questions and really get them thinking about what they just experienced in their virtual sim. Janeen, any ideas?
No, I think you covered that really well. I think those are all really good points, especially that you can incorporate next gen practice throughout simulation using some of the prompts that we had on the slides, but also the actual Indian style questioning that Nina just mentioned. So I think you covered it well.
Wonderful, thank you. We also received a very nice comment about the importance of debriefing, and the question posed was, do you believe that this person believes debriefing should be twice as long as the scenario? What are your opinions and thoughts on that?
Absolutely. So many times we get, because we're very creative, nurses are creative, and then we're nurse educators and simulation enthusiasts and specialists. And we have so many fabulous ideas that we kind of get, forget we need to focus on our objectives, and really simulation debriefing is where the learning happens. And so that really needs to be our focus. So I totally agree with that.
I was actually going to say that at least twice as long,
usually longer, because you certainly don't want to rush the debriefing process, because it is a very internal and reflective process. But also, as we've discussed the various hot and cold methods of debriefing, what I like to do is start with the live synchronous debriefing with face-to-face discussion immediately after the experience, and then follow that up with the cold debriefing or the assignments after the simulation to continue. Because, sometimes you have to sit with things and ponder them for a while before you actually make those connections. So I like to combine both with the immediate debriefing afterwards, at least twice as long.
I totally agree.
Wonderful. And then we do have time for one more question. And that question that came in is on the importance of getting feelings out of the students. It seems that sometimes that's something students struggle with identifying a feeling. So opinions and recommendations on that.
Well, I have had some snotty, ugly crying in some of my sims because, I killed my patient. And I think it's important to talk about that first to get those feelings out of the way so we can focus on learning. But it's true, some students, they don't know how they feel. And I think that's okay. If you're confused, that's a feeling. Sometimes you may have to suggest feelings. So is anybody feeling overwhelmed? Anybody feeling confused?
So I agree with what Nina said. Sometimes it's just about the way that you pose the question, because asking, how do you feel, can make us feel very vulnerable as the receiver. Whereas sometimes I'll just say, so what do you think? What was that like? And a lot of times then students will begin to verbalize those feelings indirectly. But the other thing too that I think is important is that research does show that part of the debriefing process and simulation in general is connected to the emotional connection that students make during these learning experiences. So the emotions actually are very important. That's where what we call deep learning happens. So students begin to internalize it and make sense of it and make reason out of the experience. So it is important. And sometimes that's the piece that students have to sit with and ponder after the experience. So right away, I might feel overwhelmed. I might feel like a failure or whatever. But the next time I'll remember that very significant emotional connection, and that's what will impact them in their future practice.
Yeah, I had a student 2 days later sent me this really long email because the sim hadn't done extremely well, and he was like, you've been trying to get me to think like a nurse, and I totally lost that, and I just and he just basically it was like a therapy session talking about what he had learned, and it took him a couple days to chew on it and the experience and be able to articulate what he was thinking and feeling at the time. I still have that email, by the way. I read it when I'm having a bad day.
Thank you. Thank you both so much for your insight, and thank you everyone for your wonderful questions. We are out of time, so if we did not get to your question, we will certainly address those in our follow-up. And again, we will also be holding the workshop, as Janeen mentioned, on November 18th at the OADN convention. So I just want to thank everybody for joining us today, and a special thanks to our presenters. Just a reminder, there is going to be a survey at the end of this, so if you could complete that, we would greatly appreciate your feedback. And the recorded webinar will be available on the OADN VSR website, which is free to register for. And again, the other 2 webinars are also available there, and we will also include accompanying materials for your reference and use for you to find fit. So again, thank you so much, and I hope everyone has a wonderful day.